Hello everyone, I'm Dr. Siam Subair, a professor at School of Engineering Technology and Applied Sciences at Centennial College and also the principal investigator of the project development of a novel biodegradable antimicrobial invisible glove. I'll introduce the team, Professor Noorul Hassan, co-investigator, Islam and Tarantip, two of my research students. The purpose of the research is to prevent the pathogen transfer using a device which is invisible glove. The pathogens can enter into our body through major four ways. The one is through the skin, we call it skin absorption. The second through the respiration, we call it inhalation. Through the mouth, ingestion, or through the bloodstream. If you look at the COVID virus or SARS-CoV-2, which enters through the two primary routes, one is through the respiration, that's why we cover it with a mask, and through the skin or through the skin contact, that's why we hand wash or use the glove. But our skin is pretty hardy. And if you look at it here, we got the epidermis. The epidermis is a thick layer, which is 50 to 100 micrometer in thickness, and which is mainly keratinized protein and lipids together. It's an impervious layer. So this prevent microbial growth. And also we have microbes called the resident biota or the normal flora, which is around 10,000 to 1 million per square centimeter. So which fights against the foreign invasion of microbes, even viruses. There is another biota called the transient biota. So this is where we occur through the surfaces, through the contact or the fomites or the respiratory droplets. So in order to occur these microbes, it has to go through four major steps. The pathogen should be present, virus or bacteria should be present. It should be transferred to the hands in significant numbers. There is a threshold value. And it should survive for a prolonged period of time, and we should keep it without adequate sanitization, hand washing or disinfection. And it should transfer to the mucous membrane, particularly the COVID virus. It doesn't transfer through the skin. It should transfer through a particular receptor called ACE2 receptors. So the ACE2 receptors are found in the heart, lungs, kidney. But recently it was found it is in the mouth and the mucous membrane in the nose. And those who are smoking, they expose these receptors more, so the COVID virus bind easily and transfer through the internal organs easily. Let's see how to prevent this. Hand washing has been in practice for several centuries, but it was rather cultural. But the first scientific evidence came in Austria in 1850s, and they found 16% increase in maternal mortality due to the healthcare worker, the contact from healthcare worker to the patients. Later on, many guidelines were formulated. In 1980s, National Hand Hygiene Guideline in the US, and subsequently Center for Disease Control or CDC in 1995. Later in 2019, the comprehensive guide by the WHO, which includes 270 pages. And we now know that from the media and from health professionals, the importance of hand washing. How does it work? The secret of hand washing is from the soap. Soap is an esters of fatty acid, which include hydrophilic head and hydrophobic tail. So the pathogens, which include lipid, even the viruses include the spike protein and lipids, which are dissolved in the fatty part, and later on it's dissolved, it forms the micelles and removed by the water. Is it effective? The answer is yes or no, yes and no. The yes, because for the general practice, the hand washing is a great way of removing the germs. But if it is high intensity contact, particularly in the healthcare, it may be not that effective. And the more killing force using disinfecting or antiseptic would be needed. Hand washing is great, but it has its own limitations. We need to have the access to water. And when the hand washing is very frequent, as in the healthcare setting, it is always tedious. So the easiest way to switch to disposable gloves, or the PPE. During the pandemic, the PPE market went so high up, but the downside is the environment. So around 200 billion face masks and gloves are dumped each year, so which is an environmental pollution. The another problem with the PPE is the cross transmission. So one of the studies in 2021 found that 30% of the cross transmission is through the glove. And also, some people are allergic to latex, so they cannot have the gloves on. So those are the problems. So we need to find more alternatives. The one is using sanitizers. The Nauko Pharmaceuticals, our industry partners, they formulated certain nanoparticles which are non-toxics. It's called the bioactive, which include charged nanoparticles, so which work better on the skin. The use of sanitizer has its own side effect. Most of the sanitizers are alcohol-based, which is a dehydrating agent which can dissolve the lipid, and that can make wounds in our skin. This is an experience from one of the research students due to the overuse of sanitizer and hand washing. Actually, the overuse of sanitizer expose the blood vessels and make this situation even worse. And the microbial transfer can be more rapid, and there are many studies on that. Some people are allergic or skin conditions, dermatological conditions, which prevent the use of sanitizers, because the sanitizers are generally not friendly on the skin. There are other type of sanitizers, non-alcoholic sanitizers, which includes particularly the triclosans, which has a concerned chemical. So the sanitizers are not always very friendly. Considering the limitations of existing hand sanitization method, we are developing an invisible glove. The term invisible glove may be a bit misleading. It is actually a chemical layer which provides protections against microbial transfer. In a novel project, we usually look at 3 P's, which are products, patents, and protocols. In the products, there are many invisible gloves which are available in the market, but they are for different purposes. Simply for the protections, protection against dirt if you are doing a gardening, which can protect from the poisons from the herbs. But most of them use water repelling chemicals. Some of the chemicals could be forever chemicals. We also look at multiple patents and technical documentation and SDS, because we don't want to reinvent the wheel. Similarly, the protocols come from multiple sources, WHO guidelines, ASTM, European Unions, but mostly we make our own protocol according to customized to our laboratory. Our invisible glove formulation includes 4 major components. One is the bioactive, which provides the antimicrobial efficacy. Emollients, which keep the skin in the moisturized conditions and negate the effect of alcohol or dehydration. Polymer, which prevent like a matrix on the skin and release the nanoparticles or the bioactive particles in a slow rate, and it increase the long lasting effect. And a solvent, which simply dissolve and evaporate on the application. We always look at the safety of each of the ingredients, whether they are approved by the health authorities or FDA or Health Canada. And we will take you to the laboratory and show you how to do this invisible glove.
Go.
Hello, science enthusiasts. My name is Tarandi, and this is my lab partner Islam. And we are currently working on a research project to develop the invisible antimicrobial glove under the guidance of Professor Sam Subair and Professor Nurul Hassan.
Our project is funded by NSERC and is under the management of our technology department at Centennial College, WIMTAC. And in partnership with NAFCO Pharmaceutical, they provided us with bioactive nanoparticle antimicrobial ingredient.
The current gloves that they use in the labs, they are either non-biodegradable and end up in the landfills, or if they're biodegradable, then they cause allergies to some people. And it is really hard to do the district's task with these gloves. To eradicate these problems, we are trying to make a formulation that would make sure that things can be changed using the science for the betterment of science. So we are using the skin-friendly emollients in this formulation with the bioactive nanoparticles from the NAFCO Pharmaceuticals. We're also using the polymers like chitosan and the cellulose-based polymers. We are using solvent that would evaporate and leave a layer of the invisible glove on the hand. It is visible on the nitrile glove, but when poured on the hand, it completely evaporates and forms an invisible layer on the skin. The layer is non-sticky and is really comfortable and moisturizes your hand while protecting it from the microbes.
There are many hand sanitizers in the market, and there are invisible gloves and as well. The hand sanitizers, they damage our skin, and that would actually cause microbes to enter the skin, and it will cause us more harm than good. And the invisible creams that are on the market, they're just for dermatologist use. They don't have any antimicrobial properties. So our invisible glove, they actually combine the two properties: invisible hand cream with the hand sanitizer to give us a cream that will protect our skin and protect us from microbes, and it will moisturize our skin as well. So for testing the efficiency of this cream, the invisible glove, we apply the invisible glove into the gloves, we let it dry, and then we spike the gloves with microbes. We use E. coli in the lab. After that, we let it dry again, and then we recover the bacteria on the media to see the numbers of microbes that will grow.
The plates here show the results that we obtained after the testing. These plates are the ones which didn't have any formulations on them. You can see the plates are full of the antimicrobial colonies. While if we talk about our formulations, we use different formulations with different ratios of the materials used. The formulation 1 was able to give a 2 log to 3 log reduction, which makes it efficient 99.9 to 99.99%. And talking about the formulation 2 and 3, they were as good as that. It suppressed all the growth on the plates.
The next phase of the testing, we're testing now the durability of the cream, the duration on how long this cream will give us protection on our hand. For this test, we asked volunteers from the lab to wear the gloves that the invisible glove was applied to during their normal work at the lab. Then we tested the gloves after 1 hour, 2 hour, and 4 hours to see the efficiency of the glove. Thank you.